Hey guys, this is Dr. Hub. Today we are looking at the events in case of the NREM and the REM sleep. So what is the answer here? So the events, it includes, first we are going to see what happens in stage 3 and the stage 4 of the NREM. So this includes, firstly, there is a somnambulism. Somnambulism. So what happens in case of the somnambulism? So there is nothing but there is sleepwalking which occurs. Then we move on to the sleep terror or the night terror. So there is sleep terror or the night terror. So in terms of this, it is also known as a pavor nocturnus. It is known as a pavor nocturnus, and it awakens with a scream or intense anxiety. So there is awakens with a scream. So the individual, they scream, they awake, scream, awakening is seen, and there is intense anxiety, and there is increased autonomic disturbances, increase in the autonomic disturbances. The next is they do not have a memory of this when they wake up. So there is no memory when they wake up. No memory when they wake up. And it runs in families and seen more frequently in childhood. So it is more common in the child and in case of boys. The treatment is with benzodiazepines and it is rarely required. Next is we move on to, in case of stage 3 and 4, the nocturnal enuresis. Now we move on to the nocturnal enuresis. Nocturnal enuresis. So this nocturnal enuresis, there's a behavioral therapy is the mainstay. So we have the behavioral therapy and drugs like that, desmopressin and imipramine are used. So drugs like that, such as the desmopressin. So drugs such as the desmopressin as well as the imipramine are used. Next, now we saw the NREM sleep. Now we'll move on to the REM sleep and what are the disorders associated with it. So now we move on to the REM sleep. So under the REM, the events it includes, there is nightmares. So what is happening in nightmares? There the description is that the fearful sleep without autonomic disturbance. So there is a fearful sleep. There is fearful sleep and it is without the autonomic disturbances. So it is without the autonomic disturbances that are well remembered in the morning. So they are well remembered in the morning. And then we also have TCAs which may be used. So in case of the night tremors, TCA can be administered. Then we look at the nocturnal penile tumescence. Nocturnal penile tumescence. So in this case, a normal phenomenon that can be used to differentiate. So it is used to differentiate the psychogenic and the organic impotence. Lastly, under the REM sleep events, we are going to look at the narcolepsy. Narcolepsy. So narcolepsy is a disorder of the REM sleep characterized by a disturbed sleep in the night. So there is disturbed sleep at the night and it leads to the excessive sleep in the morning. So there is also excess sleep. So excess sleep is seen in case of the morning. So this is associated with symptoms such as it is associated with symptoms such as the cataplexy. Cataplexy, it is hypogogic and hypopompic hallucination. So there is hallucination and the sleep paralysis. So the hypnagogic hallucinations are those that occurs at the start of the sleep. So hypnagogic. So this type of hallucination, they are those that occur at the start of sleep. So they occur at the start of the sleep. And also the hypopompic hallucination are those that occur at the end of sleep. So then you have the hypopompic. Hypopompic is the one that occurs at the end of sleep. End of the sleep. So what are the other events which are taking place, and we are going to see which stage of the sleep it is occurring. So we will look at the case of bruxism. So case of bruxism is nothing but the teeth grinding. So this occurs in case of the stage 2 of NREM. So it occurs in stage 2 of the NREM sleep. Next we look at the frontal lobe epilepsy. So the frontal lobe epilepsy. So this occurs in the stage 2. It occurs in stage 2 NREM sleep. Next we look at the sleep talking. So in terms of sleep talking, it occurs in all stages of sleep. It occurs in all stages of sleep, and it may accompany night terrors and the sleepwalking. So it can be accompanied by the night terrors as well as the sleepwalking. So it is common in terms of the children. It is common in terms of the children, and there is no treatment that is required. So this was about discussing the NREM and the REM sleep, and we also saw some events which are occurring, and we have seen the little description of them as well. So to learn and grow daily like this, please do subscribe.